Welcome to Frontline News from the University of Maryland School of Medicine News Center. I'm Larry Roberts. Coming up, how to treat HIV hiding in the brain. But first, hospital preparedness in the age of COVID and fighting the Delta variant. This week, the CDC recommended a return to indoor mask wearing in public in areas where the virus is spreading fast. That's because the Delta variant is more than twice as transmissible as the virus we started with.
Most people would assume that you were at risk if you had been in contact with that person for about 15 minutes within 6 feet of distance. For the Delta variant, it seems like that transmission can happen in less than a minute.
So why does the Delta variant spread so quickly?
There are higher levels in the blood. It seems that there are also higher levels in the nasal mucosa where people are shedding that, in the sort of upper respiratory tract. So when they're speaking, it's kind of coming back and forth if somebody's coughing, and that all leads to higher levels of the virus being shed and available around to infect other people.
Dr. Wilson says it's critical for people to get vaccinated now to prevent the emergence of new mutations, which could be even more dangerous than the Delta variant. With COVID hospitalizations again on the rise, a 10-year nationwide study found that hospitals are not as prepared as they should be for mass casualty events like the pandemic.
There is no question about it, there is a gap in our national preparedness architecture. This study attempts to fill a piece of that gap. How well prepared are our hospitals presently? How well prepared do they need to be to save lives?
The study, published in the Journal of Healthcare Management, developed a scoring system based on 4 pillars of preparedness: staff, space, supply, and system-based strategies.
System-based approaches are anchored in the ability for the patient to get to the right bed at the right time for the right problem.
Dr. Marcosi and his colleagues used data from the American Hospital Association's annual surveys of more than 6,200 hospitals from 2005 to 2014. In our Discovery segment, Dr. Linda Chang is the recipient of an avant-garde grant from the NIH to support pioneering HIV research. Dr. Chang hopes to use drug and gene therapy to someday treat HIV patients with neurocognitive disorders.
We think that's related to ongoing infection and inflammation that's going on in the brain. And the reason that happens to HIV patients is because we put them on antiretroviral medications, and their viral load can become actually completely undetectable in the blood. But the drug that they are taking are not able to cross the blood-brain barrier. So therefore, in the brain, there are reservoirs, pockets of viruses that can continue to replicate and cause inflammation and ongoing damage to the brain.
Dr. Chang is an expert in using brain imaging to study how HIV or drug use affects the brain. In this new research, Dr. Chang will deliver drug therapy by opening the blood-brain barrier using a cutting-edge technique under the leadership of Dr. Elias Melham.
He developed this program called the Focus Ultrasound. I learned that we could use this technique to kind of transiently open the blood-brain barrier, which will lead to increased delivery of medications. So people are beginning to use this technique in clinical trials for like Alzheimer's disease and other diseases where the medications have difficulty getting across the blood-brain barrier to get into the brain.
Dr. Chang also plans to use cutting-edge gene therapy techniques to treat HIV hiding in the brain.
HIV integrates itself into the host genome. So even if you got the drug in there, it might not remove the integrated virus that's already integrated into the human genome. So by using this new way of treating with gene therapy called CRISPR, we can go in there and cut out the part that's integrated, and then the part that's cut out then can repair itself.
Collaborating with physician scientists across departments, Dr. Chang will also use focused ultrasound to suppress brain activity in the reward center of the brain in order to suppress drug cravings in people with HIV who have substance use disorders. And that's Frontline News. Thanks for joining us. We'll see you again in 2 weeks.